uh, in your clinic, in your practice, how often do you see how often do you use abemaciclib in early breast cancer? Because we know that ribociclib is recently approved, abemaciclib was approved previously. Is it that often all the patients that come to you in the adjuvant setting with fulfilling the criteria of high risk based on the Monarch-E trial, will you go for abemaciclib for them till the approval of Kisqali or ribociclib, and then we'll discuss that later?
Well, I would reverse the question to you. I would reverse the question. Why I would not use? Because the drug improves the outcome. Yeah. If the patient meets the criteria to get access to a drug that improves outcome, in our clinics, we use this drug. You know what I mean? It means that I don't have reason for not using it.
Okay, so the insurance does cover it for all the patients in your institute?
Well, we have some specific access program that we can use. So let's say, irrespective of the coverage by insurance, that in France is something very specific with early access, etc. I would say, if I had the possibility to give it to everyone, I would give it to everyone, to all the patients who fulfill the criteria of the clinical trial. Okay. It is the general question of, we are here to propose the best to the patient. So if we have a drug that decreases the rate of relapse, usually we will give the drug.
So the safety or toxicity profile of abemaciclib for this duration, you are not too concerned? Some patients you think they would pass on that, or
I think so. That is, so your first question was clear, is indeed this drug improves DFS. In general, will you use it? I think it's important that patients get access. Then we enter in detail, that is, what do we think about this drug and whether the drug is toxic? Yeah. Indeed, diarrhea is a toxicity that usually patients don't like a lot, because these patients do not have cancer anymore. Yeah. We are in the adjuvant setting, meaning in the preventive setting. They are supposed to have a normal life. So indeed, having diarrhea in the normal life is something that is symptomatic and not that easy. Nevertheless, we have to separate the two questions. CDK4/6 inhibitor, ribo or abema, improve outcome of the patient. Then the question is, indeed abema, there is diarrhea, so it's a little bit difficult for some patients.
Yeah, I understand. Okay. So actually, the second question is the same. It's do you see ribociclib being more frequently used than abemaciclib, being more tolerable? Do you?
Yeah. So here, the question about whether it's going to be more frequently used, there are two reasons why it's going to be more frequently used.